Let's be honest for a second. Whether you're a man or a woman, losing your hair feels like watching your youth slowly slide down the shower drain, one strand at a time. And if you've spent 5 minutes looking for hair restoration Sarasota options, you've probably been bombarded by PRP clinics and miracle shampoos that do nothing but smell like old pine trees, or plug surgeries that look like someone planted a cornfield on your forehead. The mainstream medical approach to hair loss is, in a word, pathetic. It's either take this pill with side effects that'll ruin your sex life, or here's some foam that makes your hair look like a wet cat. They treat the symptom, the disappearing hair, while completely ignoring the fact that your body is screaming for help from the inside. At the Age Reversal Technology Center, ARTC, we don't do standard. I've spent decades studying the intersection of clinical science and biological optimization. I'm not an influencer with a ring light and a script. I'm a clinician who looks at biological age versus chronological age. Hair loss is a systemic health signal. If your follicles are quitting, it's because the biological soil they grow in has become toxic or depleted. We use the Wolverine protocol to fix the soil, not just paint the grass. And that distinction is exactly why hair restoration Sarasota patients who come to ARTC see results that other clinics simply cannot replicate. Most clinics in Sarasota and Lakewood Ranch treat hair like a cosmetic accessory. It's not. Your hair is an expensive metabolic luxury. When your body is under stress, nutritionally bankrupt, or hormonally imbalanced, it shunts resources away from non-essential things like a full head of hair to keep your heart and brain from flatlining. Mainstream medicine fails at this time and again because it treats the scalp as an isolated island. They'll sell you a series of PRP sessions, poke you a few hundred times, and send you home. But if your capillaries, microcirculation, are damaged, there won't be enough nutrients getting to your newly stimulated follicles to jumpstart hair growth. All hair loss results from damaged microcirculation. Beating up and injecting your scalp with PRP, exosomes, or even stem cells will not automatically restore that circulation and restart growth, though it can help. You can't grow a healthy crop on nutrient-deficient soil, and you cannot grow hair effectively when your follicles are not properly nourished. Unfortunately, nobody doing hair restoration Sarasota-wide is explaining this. Hair follicles that are healthy and producing growth have properly functioning mitochondria, which become damaged when the microvessels deteriorate. Stimulated follicles still require proper blood supply and nutrient delivery. That's where our approach is categorically different from everyone else's. This isn't rocket science, though Big Pharma would love for you to think it's a permanent, unsolvable mystery that only their monthly subscription can manage. It could not be further from the truth. My approach is different because it's regenerative, not just reactive. We treat hair loss as a binary struggle, degeneration versus regeneration. Before we even talk about needles, we look at the internal environment. We evaluate hormonal milieu. Is DHT running rampant while your protective hormones are in the basement? Nutritional density. Are you missing the enzymatic building blocks required for keratin synthesis? Microcirculation. If blood can't reach the follicle dies. It's that simple. We don't just offer treatment, we offer the Wolverine healing protocol for your scalp. We are looking to achieve superphysiologic levels of healing by stacking the most potent regenerative tools available today. Explore our microvascular health assessment to see how we diagnose the circulation piece before we ever pick up a needle. You've probably heard of platelet-rich plasma, PRP. It's been the go-to treatment for a while because it can work well when done correctly. They take your own blood, spin it down to concentrate the platelets, and inject those growth factors back into the scalp. According to research published on PubMed examining PRP for androgenetic alopecia, PRP has been shown to significantly increase hair density and thickness by prolonging the anagen growth phase of the hair cycle. It works by improving microvascular supply to the follicles, inhibiting apoptosis, cell death in the hair bulbs, stimulating the waking up of dormant follicles. But here's the catch. PRP is only as good as the patient it comes from. If you're over 40, living on fake food and chronic stress, your PRP is basically lukewarm water. That's why we don't rely on your blood. We use nano PRP, which delivers several times the growth factors and collagens derived from placental tissue. Or we use exosomes, extracellular vesicles produced by stem cells that contain hundreds of growth factors, cell signaling molecules, and mRNA, all of which serve to activate and stimulate dormant and sluggish hair follicles. These substances cost us more than processing your own blood, but we absorb that extra cost because they just plain work better. For hair restoration Sarasota patients, this distinction in biological quality is often the difference between results and disappointment. While most Sarasota clinics stop at PRP, we go further. We utilize stem cell exosomes, specifically derived from umbilical cord-derived Wharton's jelly stem cells or other high-potency sources. Think of both nano-PRP and stem cell-derived exosomes as the fertilizer in seeds to turn on hair growth. Stem cell-derived exosomes provide a potent paracrine signal, a fancy way of saying they tell your existing cells to get back to work. Research into injectable stem cell signals suggests these advanced modalities can trigger regeneration, even in cases of advanced thinning where PRP alone would struggle. By layering these concentrates, we are essentially performing a biological reset on your scalp's microenvironment. The Wolverine Healing Protocol isn't a fad. It's an ever-evolving methodology designed to maximize your body's innate healing capacity. For hair restoration Sarasota patients, this means we don't just do one thing. We do everything that works all at once. All we can do is offer the full protocol and support you if you choose to take advantage of it. Our complete protocol typically includes precision microneedling to create microchannels and trigger the primary healing response. Precision microinjections, direct microinjections ensure growth factors get exactly where they need to go. Microneedling creates the channels. Injections confirm the delivery. Nano-PRP plus stem cell-derived exosome concentrates, the heavy hitters that provide the growth factors and signaling molecules. These nanovesicles deliver specific genetic instructions for hair growth. Photobiomodulation, using specific light frequencies to increase circulation and energize the mitochondria in your hair cells. Best done with a home device we provide 3 to 4 times per week. Advanced oxygen therapies. We strongly recommend adding one or both of our advanced oxygen therapies to optimize overall health, restore microcirculation, and achieve optimum results. EWOT, exercise with oxygen therapy, and HBOT can radically enhance the process. For most patients, a home EWOT system is the most practical option. We can help you obtain one at a very competitive price, and the benefits extend far beyond hair. Peptide and nutritional therapies. Hair health is largely a function of nutritional status, and most modern humans are seriously deficient in the basics. Our Foundation Nutritional Support Program covers adequate protein, magnesium, B-complex, vitamin C, zinc, copper, and iodine. For peptides, copper peptides, BPC157, TB500, Vesigan, MOTSC, SS31, Thymulin, CJC1295, and apomorelin, and the latest breakthrough PTDDBM are all candidates to enhance hair growth depending on your profile. We often combine this with our microneedling and skin regeneration protocols, because if you're fixing the roof, you might as well paint the house. If you want to restore and keep your hair, you have to stop the leak in your bucket. Hormones. Androgenetic alopecia is driven by DHT. If we don't balance your hormones, we're fighting a losing battle. We offer comprehensive hormonal health evaluations to ensure your endocrine system isn't sabotaging your scalp. We also carry organic pumpkin seed oil, packed with beneficial nutrients, including natural DHT blockers, usable both internally and topically. Nutrition. You cannot grow hair out of thin air. We provide nutritional health optimization to ensure your soil has the minerals and proteins it needs. Circulation. This is the big one. This is why we utilize red light therapy, EWOT, and hyperbaric oxygen therapy. By flooding your system with oxygen, we ensure that those expensive growth factors actually reach their destination. When you come in, we don't start with a sales pitch. We start with a diagnostic conversation. I want to know why your hair is thinning. Is it autoimmune? Is it stress? Is it nutritional? Is it big food poisoning your metabolism? The procedure. Relatively quick, performed to ensure you're as comfortable as possible. No, it doesn't feel like a spa day, but it's not a medieval torture chamber either. The recovery. Minimal. You might have some redness for 24 to 48 hours, but there's no downtime like traditional hair transplants. The results. Hair grows slowly, roughly ½ an inch a month. You'll typically see improved quality and texture in 4 to 8 weeks, with significant density changes appearing around the 4 to 6 month mark. Stimulate, support, and repeat. Very few regenerative processes work via a one-and-done model. Think of it like exercise. One brutal workout doesn't last forever. Hair restoration. Sarasota at ARTC typically requires a minimum of 3 sessions, about a month apart, with refresher stimulation every 6 to 12 months for sustained results. The other components of the Wolverine Healing Protocol significantly magnify and preserve those benefits.